Good morning. This is Dr. J. Hartley at the Hartley Chiropractic and Scoliosis Center in St. Augustine, Florida. And today we're going to be talking about detecting ligament damage in the Flexion Extension Cervical X-ray and the Alar Cervical X-ray. This is very important because there can be undetected ligament damage or segment instability at occiput C1, C2 that may result in headaches, neck pain, numbness, facial symptoms, many neurological conditions that are undetected. These can be caused from either birth trauma, fall on the head as a kid, car accident, things like that. So the first one we're going to look at is cervical flexion extension. So we're going to have Amanda tuck her chin down as far as she can, go like that. We're going to take an x-ray right here. Then you're going to look up at the ceiling, and that cervical extension, we're going to take an x-ray right here, okay? So now we're going to look at those x-rays. This is the cervical flexion x-ray. And when you tuck your chin down, you're looking to see if bones slide forward. If they slide forward, that's an indication of ligament damage back here, the posterior longitudinal ligament. This one's the cervical extension x-ray, and the patient's looking up to the ceiling. If the bones slide backwards, then it's an indication of damage to the anterior longitudinal ligament. When this patient looks up, C2 translates posteriorly 4.7 millimeters. That means there's damage to the anterior longitudinal ligament. C3 slides back 5.3 millimeters. That's an indication of damage to the anterior longitudinal ligament. Anything over 3 millimeters is out of a normal range. Now, we create a very nice chart with our software that actually measures those ligamental instabilities, so it's very easy to document whether the ligament damage is there and how it responds to our care. Now we're going to go and do the Alar X-ray. So Amanda, go ahead and have a seat here facing this way. Okay, you're going to open your mouth as wide as you can, chin down a little bit, tip your head to the right. So this is called the right cervical flexion or right alar view. We're going to take the x-ray there, look up to the ceiling, head to the left, chin down a little bit. And we're going to take the x-ray there. That's left cervical flexion or left alar view. So now we're going to look at the results of that. And first, let me show you some biomechanics of the spine. Normally, when we look at the spine, if you tip your head, the bone should stay one over the top of the other. So I'm going like this, and we're looking at C1 and C2. They should stay one on top of the other. That's a sign of a healthy alar and accessory ligament. If they slide as you tip, that's a sign of damage to the alar and accessory ligament. So let's look at some x-rays now. So on this patient, the edge of C1 when they tip, which is right here, slides off of the edge of C2 is right here. So normally when you tip, it should go just like this, staying one on top of the other. If there's ligament damage, then it's going to slide, okay, like that. Okay, so on this patient, when they go to the right, theirs is 2.7 millimeters. Normal is 1.7 millimeters or less. On this one, when they go to the left, okay, again, normal would be C1 staying on top of C2. When there's ligament damage, C1 keeps moving. And on this patient, when they go to the left, it's 4.4 millimeters. So what that means is C1 translates 4.4 millimeters off of C2, creating this difference between the yellow and the red line. So this patient bilaterally has Alar accessory ligament instability or damage, and then on their cervical flexion and cervical extension x-ray and extension, they have anterior longitudinal ligament damage at C2 and C3. If you have any further questions about cervical flexion extension analysis or Alar ligament analysis, please give me a call. I'm Dr. J. Hartley, Hartley Chiropractic and Scoliosis Center. Our number is 904-679-3233. The website is drjhartley.com. Have a great day.